as act of charity or as act of humanitarian aid or assistance, but as act of obligation, as act of justice. The war was brought by the Western world, and with the war, the still ongoing killer number one, the tuberculosis.
The CT scanner, an essential diagnostic tool in the treatment of tuberculosis, has enabled Dr. Biat to paint a precise picture of the true scale of the TB crisis. The findings of his ongoing patient research have the potential to reignite the tuberculosis debate worldwide. The Cantabopa research team is discovering that TB is the underlying cause of many other shocking diseases appearing in children, the extent of which the World Health Organization is yet to fully acknowledge.
It comes down to money and to politics, because tuberculosis is the cheapest weapon of mass destruction.
Every 15 seconds, someone in the world dies from tuberculosis. Extreme poverty is its breeding ground. It is a common belief that TB is mainly found in adults, particularly in the frail and elderly. But poor children, who are often malnourished, are especially vulnerable to this infection. The other common misconception is that tuberculosis only affects the lungs.
This is a kidney problem caused by the imbalance. It's no more the balance of immunity is disturbed because the child is suffering from tuberculosis.
When tuberculosis weakens the immune system in children, it renders them vulnerable and susceptible to other crippling diseases like dengue fever, encephalitis, malaria, meningitis, and HIV. In children, 70% of TB cases affect the lungs, and 25% affect the lymph nodes. A silent 5% makes its way through the bloodstream to infect the bones and major organs. TB can have long-term effects on children, rendering some of them deaf, blind, and totally paralyzed from TB meningitis, even after the disease is treated and cured.
I never seen so many tuberculosis as in Cambodia. For example, the skin tuberculosis in Europe. I never seen the tuberculosis in the skin. But here, in the skin, in the testes, everywhere we can find the tuberculosis.
Cantabopa hospitals have treated thousands and thousands of children with TB. But the doctors believe this is only the tip of the iceberg.
This is a classic encephalitis, but caused by tuberculosis, with a classical sign in the CT scan.
The prognosis, do you know?
We do not know. Maybe we can save, but we do not know. But it's not only the question to save, it's even the question if it's sequela afterwards, handicapped. So it's very important to do the ventilation, give oxygen and all these things, not to have the brain damage. We will see.
ក្មេងប្រុសអាយុ3ឆ្នាំចូលសម្រាប់ ICU ដោយសាររឿងប្រកាច់ប្រវត្តិជំងឺនោះគឺឈឺចាប់ដើមឡើង2ថ្ងៃមុនហ្នឹងដែលមានក្អួតប្រកាច់ហើយនឹងទន់ជើង
Over the years, there's been a steady increase in the number of brain tuberculomas, the most tragic and severe form of TB in children.
We have a lot of children with a tumor in the brain. You can see here the lungs is a miliaris, and here you can see the tuberculoma. So it's a tuberculosis in the brain. And now what is interesting, we can find much more tuberculoma than expected. Still tuberculoma not yet doing symptoms. So even the brain is destroyed by the tuberculosis of these children. But we can save them.
Throughout the world, international health experts continue to focus their attention on fighting TB in adult patients. It is argued that adults are more likely to spread the disease than children because young infants cannot produce sputum, supposedly making them less contagious to others. The sputum test is the most common way of testing for TB in adults, but as young children cannot cough up enough sputum for analysis, its diagnosis is far more difficult. In many cases, the tuberculosis is only visible through detection of its primary complex, which presents itself as a calcification of the hilar lymph node. The big problem is that this primary complex is often not visible in X-rays, especially if it is smaller than 3 millimeters in size. The only means of accurate detection is either by use of the CT scanner or the analysis of tissue samples. Dr. Beert's insistence on the installation of modern diagnostic equipment and technology has led him to clash with many experts, including the president of the Save the Children Fund, Princess Anne.
And she told us in the laboratory, these facilities are too expensive for poor countries such as Cambodia. It's wrong to install it. First, Cambodian must learn to wash the hand, to learn the hygiene, and then you can go on. This attitude, this arrogance is nothing else than neocolonialism and has to be changed. You need the modern facilities, the same standard as you use in Europe. Otherwise, you miss a diagnosis and they tell you these facilities are too expensive for poor countries such as Cambodia.
8-year-old Siet Thin can no longer walk without pain. An X-ray has detected tuberculosis in her lungs, with a secondary infection in her hip joints.
Get step but very painful. Step forward. See?
Osteoarthritis due to the damaging effects of tuberculosis is incredibly destructive. If not treated through surgical procedures, it often leads to permanent bone damage. The doctors have seen many cases where the infection has completely destroyed the spine.
The mother asked, I don't know, is a non-professional person at the village give injection. The child get a lot of injection already outside. And then one time perfusion and no improvement, no any improvement, because they did give a wrong injection. They did give a wrong diagnosis. You can see from outside, you can see nothing. But inside, the bone is erosion and the hip and the abscess internal. Hãy subscribe cho kênh Ghiền Mì Gõ để không bỏ lỡ những video hấp dẫn. Chợ nó khôi khát tại chợ đại khôi khát nắng dương cô vô chào mà hỏi được chứ dương được chia ba đôi chừng ngư độ bến đừng nằm sát viên đừng chia rồi chia chợ nó mình khôi từ mục tiêu đấy chợ chụp thầm nắng hay nơi tại trăm cá bị vọt bỏ chợ màu vinh rồi chứ này dạ pe bị buôn là tất từ làm mùi là tất vì đừng lo bớt xa làng bên chợ.
Billionaire philanthropist Bill Gates has committed funding of $300 million to the global plan aimed at stopping the spread of tuberculosis. His main focus is on finding effective vaccines to combat the numerous drug-resistant strains of the TB infection.
There's challenges like the association with AIDS, the multi-drug resistance, but I think this plan takes on those tough problems and can make a big difference.
There is currently no effective vaccine for tuberculosis. There is also emerging consistent proof that the commonly used BCG vaccination, which is recommended by the World Health Organization, simply doesn't work.
90% of all tuberculoma children with brain tumors by tuberculoma were vaccinated against tuberculosis by the vaccination BCG. So what we know up to now, that the BCG vaccination is useless. This is known in the United States since 1942, in Switzerland since 1970, in France since 1 year, and in WHO not yet. So the vaccination BCG is useless. But what is new, and we can prove this in a significant way, it's significant. Children who were vaccinated have a much more severe disease of tuberculosis than children who were not vaccinated.
The primary goal was to establish a rapid and specific diagnosis and the most sensitive technique.
Biologist Denis Laurent is currently working with Professor Kurt Schofer from the renowned Bern University in Zurich. They are also striving towards finding a TB vaccine and have at their fingertips one of the world's most comprehensive patient databases for tuberculosis cases in children.
And we need to define the strains in order to understand why this strain makes this disease and maybe another strain makes another type of disease.
Several years ago, Dr. Beat made a sensational discovery. Many infants hospitalized with illnesses such as bronchitis and diarrhea were dying of unclear causes. In 2002, the research team tracked down the cause. Tuberculosis was found in the gastric juices of young infants, leading Dr. Beat to believe that TB could be transmitted from mother to child via the mother's breast milk or before birth in the womb. His theory suggests that a healthy mother who is the carrier of TB can pass on the germ to her child without falling ill herself. Although these theories have yet to be proved, Dr. Beat is confident they soon will be.
Only at the end of the pregnancy, the immunity of the mother is reduced. And that's why the tuberculosis is a breakout of a systemic tuberculosis, but only for a very short time. The mother is still in good health. As soon delivery, the situation is normalized in the mother, but the child has in the stomach the germ. And this can provoke this infantile tuberculosis. As soon the child is getting a viral infection, this virus can trigger the outbreak of the tuberculosis, of the systemic tuberculosis in the infant. This, I hope, we can prove.
Dr. Beat has already made a vital contribution in the prevention of the spread of HIV/AIDS in Cambodia by focusing on targeting the disease before birth. His maternity unit for HIV-positive mothers is a global first for a developing country. Every month, the center caters for the birth of more than 400 babies. Before being admitted to the hospital, every mother signs a document agreeing to be tested for HIV. If the test results are positive, the mother is administered with nevirapine just before birth, and a cesarean is performed to deliver the baby. The child is treated with nevirapine from the 3rd day and is bottle-fed with artificial milk. The mothers then return to the hospital with their babies for monthly checkups. Compliance to this regime is 100%, therefore ensuring children are protected from HIV/AIDS from birth. Dr. Beat is certain that similar inroads could be made for the prevention of TB transmission from mother to child. With appropriate antibiotic treatment, TB can be cured. The Canterbury hospitals treat thousands of infected children every year with a 6 to 12-month drug regime. For the treatment to be effective, it demands total compliance. Otherwise, there is the risk of creating a drug resistance throughout the community. The hospitals run an extensive TB education program, and remarkably, there is 90% compliance amongst outpatients. Drugs are provided free, and the patients also receive money for traveling costs, so that they are able to complete their regular checkups. By achieving these amazing results, Dr. Beat is proving that effective treatment of TB can be implemented. And more importantly, he's also demonstrating that if it is possible in Cambodia, it is possible anywhere in the world. But it takes discipline and a certain commitment to perfection.
I think there you have to be perfect. If you have not this feeling to be perfect, then you should stop. It's the same as for a musician or an artist. If he's no more nervous before a concert, maybe he should stop. If a doctor is no more nervous before he starts an anesthesia, or before he starts his visit or sees his patient, then he must stop. You must be perfect.
Fundraising remains the biggest burden Dr. Beat is continually faced with. The pressure increases every year to raise the $20 million needed to keep the 4 Canterbury hospitals running. With no World Health Organization to rely on, or a wealthy benefactor like Bill Gates, it all comes down to one man and his cello. The hospital's very existence is fragile, given that it can only ever cover operating costs 5 months in advance. The deep and growing concern now is, what will happen to the hospitals when Dr. Beat is no longer there?
I'm a prisoner, and I'm imprisoned by my conscience and by my perfect, to be perfect in this hospital. I'm imprisoned.
I think he can't leave it because he knows for the moment when he leaves that we risk that it won't go on with the Canterbury Hospital because of the finance. On the medical level, there will be no problem. The colleagues here work very well without him on the medical field. But if he isn't here, maybe the money won't come. And I'm persuaded for the moment the donations, the fundraising would be much more difficult if he wouldn't be here. And I think because he is here and people know he is still here, he finds still the money.
So I'm forced to go to go on playing the cello, because sometimes you are so tired here and a little bit depressed from time to time that you have not even the courage to open the cello. And on another way, okay, it helps the cello when you play and to forget a little bit the things here. Today is the last day in the year I talk about the money. I'm very sorry. And when I was young, I was idealist and entertainer. and now I'm annoying people and myself. I'm annoyed talking about money. I was idealist, and I get to be older, and I get to be materialist. Because without this money, 60,000 children will die per year in Cambodia. And that's why I made a song about our bank account in a foreign language. I am the Dr. PC 860699.1. We still need money, just your money. I am the Dr. PC 86. Do you remember this very number? I am the Dr. PC 860699.1. You still need money, just your money. Why poor children should not have the right of getting drugs and care, being good enough to save the children living in a richer world. Why? Do you remember? We really wonder why poor children should not have the right of getting drugs and care, being good enough to save the children living in a richer world. Why? Do you remember? We really wonder. I am the Dr. PC 8.